I've been asked about diagnosing learning disabilities in your adulthood. And some of you might have escaped getting diagnosed with a learning disability in your childhood. A lot of these testing organizations insist on a historical record or historical documentation of having a learning disability in your young years. Now, the majority of people who come to me, because I'm known for doing these evaluations for high-stakes testing, they come with a stack of documents, an inch thick, and that's very helpful. It proves that you've had this difficulty all your life, but you can be diagnosed in your adulthood, and one of the main reasons is because as a bright person, you might have wiggled your way around and, studied extra hard in your younger years. Or, more likely, is that the learning disability hasn't come up against really demanding circumstances. So, you may not have met your match, so to speak, in your adulthood. I've had people who did fine in all their schooling, all the way through medical school, for example, and they didn't meet their match until they had to pass their medical boards. I had an ophthalmological surgeon who didn't really meet his match in terms of his learning disability until he had to pass his ophthalmological surgery boards, where you have to basically memorize a stack of books 6 feet high. And believe me, those books are dense. He was fine up until that point, could pass all his exams, or did well enough anyway, to get through medical school and residency of 5 years of ophthalmological surgery, and then he couldn't pass his boards because his learning disability didn't kick in until that particular demand, which is of course very high demand. You can get through, in my learning disability, I got through undergraduate school, graduate school at Yale, but that was in architecture. That wasn't reading a lot. And then finally PhD program, got through all of that and licensing and so forth. 10 years after my PhD, I took some tests and found out, oh my God, I'm one of them. My reading was at the 35th percentile, my other scores were high, and that, at that time, meant that I was classically diagnosed as learning disabled, because my reading comprehension, timed reading comprehension, was significantly below my overall intelligence. Now, you might be in that kind of situation, where you might have worked your ass off all your life trying to, achieve things, and in fact you did, but when it comes to something as tough as the LSAT or MCAT or GREs or something like that, you just couldn't get a good enough score, couldn't finish the test even, because, your learning disability was kind of kicking in at that high demand situation. There's technical reasons to explain this. Learning disabled people like you and me, maybe, we don't develop as well as other people, and as our peers are achieving, we don't achieve quite as well, and so there's a gap that happens over time. And so as the demands increase, we're not quite measuring up to snuff as compared to other people. Now I'm going over it very quickly just to kind of get the point across, which is, you might be learning disabled even though you've never been designated as such. And also, parents may not, if you're doing okay in school and you're not a pain in the neck, maybe you didn't, you did well enough to get by, but you knew you weren't measuring up to your potential. You knew that. And maybe you kept it quiet, maybe you were a polite person, and so forth. So this is an aspect of a learning disability that can be diagnosed in adulthood that might, if this were recognized and you you got evaluated and got extra time for these really high demand tests, maybe this can make a big difference in your life if you could get the accommodations you need. So you might consider getting such an evaluation with me or someone else, to see if you can get the extra time you need to get a really good grade on these tests.